Hi everyone, and a very good evening to all our viewers here on TV1. I'm Dr. Dilshan Fernando, and this is your weekly dose of wellness here on Healthline. Today, we are going to talk about a condition so common and so prevalent in today's society that I'm sure most of you, our viewers, would have suffered from this at some point of your life. I'm sure some of you are battling this condition for years at end. The problem is, the condition is so common that some of us tend to self-diagnose ourselves, and what's worse is some of us tend to self-medicate ourselves as well. But the problem being, without proper medical attention, if you tend to self-diagnose and medicate, you might be missing out on some more conditions which are much more sinister and have many more severe effects. I'm sure I got your attention now. So, today our topic of discussion is what some people call gas, some call it gastric. Our topic of discussion today is gastritis. And joining us today to share his expert opinions with us, we have Dr. Isurujith Liyanage. He is a consultant gastroenterologist and hepatologist, and also a lecturer at the Faculty of Medicine at the University of Sri Jawadanapura. A very good evening to you, sir.
Good evening.
So, first of all, sir, to untangle this confusion, tell our viewers, what is gastritis?
Right. So, Dilshan, as you correctly said, it's one of the, I believe it is the most loosely used medical term, sometimes even amongst the professionals. So, if we think of the definition of gastritis, it means inflammation or redness and swelling and of the inner lining of the stomach. So, it's in other words, it's the inner lining of the stomach falling a little sick. But as you said, people use this for a variety of different conditions and presentations, and we often hear people or other people think gastritis. The word comes from the term gastrium, which means the stomach, but a lot of people attribute the gas to this. So, they think when you have puffiness and too much of gassiness, that is gastritis, which I think is incorrect. And any aches and pains across the stomach, abdomen is attributed or used as gastritis across the platform. So, whenever someone comes and tells me that they have gastritis, I first ask them, okay, tell me what's wrong, what do you feel?
So, I mentioned, sir, that this is very common, but in your experience as a gastroenterologist, how common is it really? And in current context, in today's competitive world, do you see the prevalence rising?
Well, the prevalence of gastritis, it's very prevalent. It's seen in almost every other endoscopy that we do. So, the definitive diagnosis is through an endoscopy and ideally with a biopsy. That is how you should, like, for research purposes, you have to you can say that it is gastritis, but we can look at it and say that it's red and swollen, and then we can call it gastritis. But most of the time it is a clinical diagnosis, where when someone tells us they have pain and discomfort in the upper abdomen. So, in that context, it is very prevalent. But then we later discuss what can give rise to that kind of a clinical scenario where they would have these symptoms and the pain in the upper abdomen, whether it is gastritis or not is a dilemma. So, we wouldn't know the exact prevalence because it is a highly technical diagnosis which requires invasive testing, which is often not required in most of the people.
Exactly. Now, as you correctly mentioned, gastritis means the inflammation of the lining of the stomach, but we see that many conditions together give rise to this, and it's a multifactorial disease. So, what are these conditions really that give rise to gastritis, and what are the risk factors involved in this?
Right. So, again, I think there are two aspects that we need to discuss. One is hardcore gastritis, that is technically gastritis, when there is redness and swelling of the stomach, and then we have to talk about the symptom, the epigastric pain, with or without inflammation. They're kind of, because that's a clinical diagnosis. That is something that we judge, we estimate when we talk to someone, touch someone's tummy, examine, and then we come to that diagnosis. But it's not, as I said, it may not necessarily be gastritis. But if you think of the technical gastritis, it can be, of course, without any reason. It can come in a lot of people spontaneously, but some medicines can predispose someone to have gastritis, especially drugs like non-steroidal anti-inflammatory drugs, steroids, and some certain antibiotics also can cause some irritation in the intestines. So when I said non-steroidal anti-inflammatory drugs, for our viewers, it's mainly strong painkillers that you get for arthritis, etc. And then there is an infection which is called Helicobacter pylori. That is the commonest cause of gastritis across the world, and the prevalence, or that is not very common in Sri Lanka. We have few studies, and it's around 1 in 10 or a bit less than that amongst people with gastritis. So it is again something that we need to consider, because a lot of people empirically treat for this, which is not the correct practice. So it's that infection, Helicobacter pylori, is not very common in Sri Lanka. And stress. So that is maybe the question of the day, whether stress makes it worse. It does, because increased stress hormones increases acidity in the stomach, and also impairs. Now, stomach is a very peculiar organ, because the acidity within the stomach is very high, and there are a lot of mechanisms to prevent that acid from attacking the cell wall, the wall of the stomach. And there are some mechanisms, even if it is attacked, it repairs itself. So these mechanisms are hindered or troubled when one is stressed. Now, put that aside, the symptom, or rather feeling of epigastric pain, in addition to what we have discussed, can also be due to another variety of causes. And if it's originating from the stomach, without gastritis, stress can cause epigastric pain. So that is when when someone is stressed and anxious, we all know that we get a bit of a heartburn. So that context can prolong and linger on if you are chronically stressed and worried about it. So that is more of, we call that functional dyspepsia and functional symptoms, where there is no gastritis, but they can have the similar pain. That's mainly due to increased sensitivity of the nerve endings in the stomach.
So in the current context, where most of our careers are very demanding and stressful, I believe that would be one reason why such a lot of people experience this epigastric pain. So moving on, gastritis, along with gastritis, we see two other entities in the same bracket. It's the gastroesophageal reflux and also peptic ulcer disease. So what are these two entities? What's gastroesophageal reflux and what is peptic ulcer disease?
Right. So I think that's an excellent question. Now, all these things are related to the acidity of the stomach, and peptic ulcer disease is when this acidity causes ulcers. So ulcer means a small wound. It can be big, small, so of any size. So when there are wounds, we call it peptic ulcer disease. But it is actually directly related to gastritis. Whereas reflux, which is often thought or rather labeled as gastritis by our patients, is an entirely different condition. But yes, there is a contribution by the acidity. But what happens is that there is in simple terms, there's something like a valve at the end of our food pipe, that is, when it enters the stomach, there is a small valve, a mechanism, we call it a sphincter. And that prevents the contents of the stomach from coming back up, and that in a lot of people that can dysfunction. Sometimes it's due to a problem with the structure, how it's arranged, and sometimes it's just due to different reasons, and stress again contributes here, sometimes medicines. So when that valve does not function properly, we get contents of the stomach coming up. And that can cause a burning sensation in the chest, which we call heartburn, and sometimes that's quite often confused with heart attack and pain arising from the heart. and they can have increased reflux. So reflux can manifest as burping in simple terms, or producing air. Sometimes they can even produce an acidic taste to their mouth. So that is reflux disease, and the technical term is gastroesophageal reflux disease.
You were talking about the anatomy of the digestive system. We know that, like you correctly mentioned, there are some innate adaptations of the gastrointestinal system to prevent these conditions from happening. But we also do know that there are some errors, or I would say inborn errors in this anatomy which predispose towards this condition. If you could explain to us what these errors are. You mentioned about the sphincter not functioning properly, the valve, but other than that, are there any other errors in the anatomy that could lead towards these conditions?
Right. So the commonest that we see, which is again almost seen in about we don't have exact estimates, but roughly in one in 4 of all Sri Lankans, is a condition called hiatus hernia. Now again, that itself is a separate topic, but what hiatus hernia is that in some people the stomach is situated slightly higher. So the of the sphincter. So there's a valve, and the stomach has kind of migrated through that valve, and that makes the valve not work properly, and these people can have a lot of reflux, but it in itself is not really a disease, because it's so common, and it's a slight. I used to tell them that it's a slight so you're quite a little different, but it's not that you have a disease. But some people, the reflux is so bad that they get a lot of burns and severe heartburn, and when we do endoscopy, we see a lot of ulcers and changes in the food pipe. In that context, they need more testing and then correction if that is required, but it's very few, very handful who would require these kind of advanced measures. But hiatus hernia is very common, and I'm sure a lot of our viewers would have had that diagnosis written somewhere, especially after an endoscopy, and a lot of people are unnecessarily worried about it, and it's not really a disease.
So according to you, even if they do have hiatus hernia, if their symptoms are not too severe, it does not need correction?
Not at all. So hiatus hernia very rarely needs correction, which is, again, when we use the word hernia, everywhere else, any other hernia across the body needs correction. This is one of those rare places where you have a diagnosis labeled as hernia which does not need any intervention.
Right. You mentioned some of the symptoms associated with this condition, but just for the clarity of our viewers, if you could just list out what to look out for, because our people tend to self-diagnose, which is not the best thing to do. But just for the clarity of our viewers, if you can just list out what are the symptoms associated with this condition.
Right. So with regards to reflux, there are two things that I want to emphasize. One are the classic symptoms. The other set of things are what I call red flag signs, where they need to worry and seek medical help. So typically reflux is when they have increased production of gas, acidity, and a weird taste to their mouth, and sometimes they can have burning sensation in their chest, and that typically, not essentially, but typically comes after meals, and when they lie down. And some people can get a little bit of a cough, especially at night when they lie down. If you eat something heavy, fatty meals can make it worse. So those are the typical features or symptoms of reflux. Now, so reflux occurs when the valve doesn't function properly. So that could be like the dysfunction of the valve can be due to a cancer itself. So we wouldn't know. So there are things that we call red flag signs that everyone needs to remember. And if you have them, you have to seek medical help, and more often they will require an endoscopy to assess. So these things are red flag signs. Of course, is the most important thing is a recent change. So if this is something that you suddenly got, which you never had, and if you are roughly about the age is more than 45 years, so if you are relatively old, and it's something a new onset or something that had not been there, or if there is a recent change in the nature, both reflux and also the gastritis symptoms, also the pain in the tummy. So if it's something very new, they need to get rather seek medical help. And if there's any problem in swallowing, if there's pain when you swallow, or if you cannot swallow, if the food gets stuck somewhere in your food pipe, if that kind of a feeling comes, then again that is a point where you should get medical help. And if there is loss of appetite, that is if they lose their appetite, if there is weight loss that is unexplained, if there is anemia, and if you think there is bleeding from your gut, especially from the upper part of the digestive tract, if there is bleeding, your stools would look black, but black in the sense it will look like tar.
Exactly.
And that is something that we call melena. And so any of these things are called red flag signs, and if they are present, it's always good to get medical help.
Now, in our practice as doctors, we have come across patients, especially in the emergency department, where they come in and say, "Doctor, I'm having an acute episode of gastritis." But when we do further investigate, we have found much more sinister causes for their symptoms. So, what are the other more severe and sinister conditions which can mimic this?
Right. So that I think is the most important message that we want to convey to our viewers. Well, there are two sides to this. Now, when you hear these conditions, if they're not really, if you don't have, because it's so common, if you don't have these red flag signs that we just discussed, and if you have seen a doctor and been reassured, it's very unlikely that you'd have any of those, because it's very common where people are worried that they have something very, very bad. So it works either way. Now it can, so these other causes can arise from the digestive tract, or you have a few other organs in that region. So from the digestive tract, we are looking at the most common, or not the most common, but the most important sinister cause that we need to think of is cancer. So they can have cancer in the food pipe and the stomach. As I told you earlier, as we mentioned, cancers are more common when your age is above 45 years of age, which is why that is we kind of endoscope and further assess people. So it's not very almost non-existent in the young age groups. And I think I want to emphasize again on the red flag signs when it comes to cancer, and especially cancer in the stomach. In addition, would give you early satiety. You would feel full without or rather when you eat a little bit of food. So you have cancer, and then there can be ulcers which are deep that can give rise to bleeding, and then when it comes to when you move away from stomach to other organs, there is pancreas there, so pancreatitis can present with pain in that region, and then issues with the liver. So there are a whole variety of things that can go wrong with the liver. So they can also present with pain in the upper abdomen, and gallstones. We have very often seen people having gallstones and gallstone disease, and thinking that they have gastritis for a long time. These are the common other problems that can present in a similar way.
Right. In an acute episode of gastritis, we know that it can mimic what you feel in a heart attack, like you mentioned earlier. So I think it would be very beneficial for our viewers if you could just explain to them how would they differentiate between whether they are getting a heart attack or whether it's just heartburn associated with the reflux. Because if you are indeed having a heart attack, you can't just stay at home and think, okay, this is going to resolve on itself, or I'm just going to take my gastritis medication and that it's going to resolve, because they would need to immediately present themselves to the nearest hospital. So if you can just elaborate on how they could differentiate, or if they should at all differentiate whether it's a heart attack or gastritis, if you can elaborate on that.
Right. So very often even the doctors cannot figure out whether it's a heart attack or a reflux or a heartburn or gastritis. And when we see risk factors and when we have a doubt, we always do an ECG. So in other words, if you have any doubt and if it is something new you have not seen before, it's always good to go. If you have even burning sensation in the upper abdomen, which we call epigastric pain, that can itself be the initial presentation of a heart attack. So the first thing to do is to get a medical help and get yourself assessed. Again, risk factors for heart attack should be kept in mind. If there is a family history, if you have other conditions like diabetes, high blood pressure, and other risk factors for heart disease, if you smoke. So if you have those risk factors, to be more careful. And in addition, when pain from heart attack, if it's not an acute attack, usually come or rather worsens when you exert yourself. So when you climb a flight of stairs, when you walk fast, if your pain comes, if you have any discomfort in your tummy when you walk fast, when you climb a flight of stairs, then you should never think that it is gastritis. You should always go get medical help to exclude cardiac causes.
That is indeed one of the most important messages that we wanted to convey as well, because people do tend to neglect their symptoms, associating them to the gastritis or reflux that they have. So as you heard, you should not be neglecting any of these red flags that Dr. Isurujith mentioned. So moving on with our questions, some of these patients come and say, doctor, when I eat my symptoms are relieved. But then there is another category who come and say, doctor, my symptoms are aggravated when I take a meal. Why is there this variance? Can you explain this to our viewers?
Yes. So classically, when we were medical students and learning, we used to say when the disease is in the stomach, it's different. When it's in the first part of the small intestine, which we call the duodenum, it's different. But that differentiation is hardly seen when we try to correlate with the real picture. So we really don't go by that to see whether they get better or not after meals. So that concept is not that we don't use it that much. So the reason, the technical reason is that sometimes when you have gastritis, you have, assuming that your the inner lining of the stomach has taken ill, it's painful, and sometimes when you're hungry, your stomach collapses, and that collapsing process causes pain in some people. And in these people, when you fill it up, again, it's like having some wounds here, some burn here, and then when you do this, it hurts, and when you do that, the pain goes away. So that's the concept. That's how you get pain when you have problems with the stomach's lining. And on the other hand, when you eat, again, that is a misconception that is there amongst our public. Acidity comes after a meal, and when you eat, acid is secreted to digest the food. It's not that when you're hungry your acidity increases. It's a misconception. So as you said, when some people eat, with that acidity that comes in, you can get a little bit of burning sensation, and that in those people they can have pain at that point. And about 95% of the acid in the stomach comes immediately after meals, and only 5% comes during fasting.
So talking about eating and dietary habits, we see certain patients come and say, if I eat oily food, it's bad for me. If I eat spicy food, it gets aggravated. So in your experience and in with your expertise, are there certain types of food that these patients should avoid?
Yes, there are food that we know that would make food stay longer in the stomach. So when you eat things that are difficult to digest, and when you eat oily food, it stays in the stomach for a long duration, and as long as food is there in the stomach, acid pours in. So when there is food in the stomach, that causes irritation, and especially reflux worsens when there's food in the stomach, obviously. So when you have these kind of conditions, it's always good to avoid oily food, and also food that contains caffeine, coffee, chocolate, and things like that, and then alcohol and tobacco smoking, they all worsen gastritis, and also they relaxes that valve, the sphincter, and worsens reflux. So these are generally the food that they need to avoid as in a complete group. But in addition, a lot of our patients are sensitive, including you and me. We are sensitive to certain type of food. It's like we get a runny nose, we get a blocked nose when we are exposed to different type of dust. So some people would be sensitive to animal dust, another person to something else. So similarly, we are sensitive to certain different types of food, and that sensitivity also can give rise to pain and sometimes gastritis. So there would be people who are sensitive to wheat flour, and they will not tolerate bread. There will be people who are sensitive to tomato, and their gastritis would worsen when they have tomatoes. But those are very individualized, and you should not go by what someone else is sensitive to, and you should identify what you're sensitive to and avoid as much as possible.
Right. Now moving on to treatment modality, we know that we can categorize them into lifestyle changes and medication. We can elaborate on what options are available to treat these conditions.
Yeah. So, when it comes to treatment, first of all, if there are red flag signs and the doctor thinks that the patient needs, they will have to have an endoscopy, not to diagnose gastritis, but to exclude those sinister conditions that we just talked about. And thereafter, treatment has several kind of modalities. One would be to control the symptoms. So, there are different over the counter medications, syrups, etc. Available in the market, and a lot of them can be bought on your own, and they are over the counter medicines across the world, and they would relieve your symptoms on a temporary basis. And then we have acid suppression medications, which would stop the acid from coming into the stomach. And there are drugs like omeprazole, which is the prototype drug, and then there are other drugs that we take, which are like ranitidine, cimetidine, so that group of drugs. So there are different drugs that the doctor would prescribe to get rid of the acidity if they think the condition is very bad. And then there are other drugs that which are called prokinetics. They would make the stomach empty fast, and by that process we plan to reduce reflux and also reduce the acidity, or rather reduce the amount of the time that food stays in the stomach. Now, these medications are very commonly used, or rather misused, and bought by the patients themselves in pharmacies. Now, the biggest problem with these medicines is that, let's assume that a person is having a cancer, and the symptoms are due to that cancer, and that symptoms actually are triggered by the acidity touching the cancer. And when you take these medicines, you'd get better, but we are hiding, or we are masking the symptoms of something very sinister which would have been picked earlier. So, the biggest problem in self-medicating in such conditions is that even those sinister causes would get better symptomatically. They would feel better, but it will come back again. It might not even come back again, but we would be missing out on these diagnosis. So, these medicines actually should not be taken on your own, and they should be taken on a highly prescription based condition.
I think that is again one of the most important messages that we want to convey to our viewers, because self-medicating, self-diagnosing, you might be missing out on something very sinister that you tag as what you call gastritis. So, with the time constraints, we are coming to a conclusion in this episode of Healthline. So, as your closing statement, what would be your advice to our viewers, how to protect themselves, how to live with this condition, whether it's possible to get rid of it altogether? So, as your closing statement, what would be your advice?
Well, my advice is to again look for these sinister features, and if there's a new change, you need to get medical help. But again, it's so common that you don't have to go to a specialist, you just have to talk to your doctor about this condition, and eat healthy and avoid these oily food, fatty food and artificial food that will make your entire digestive system healthy. Avoid tobacco, smoking and alcohol as much as possible, and also try to relieve your stress, and that is the way to get rid of most of these symptoms.
And there you heard it from the breast. You need to be very attentive and not try to self-diagnose yourself with this condition that we call gastritis, because you might be missing out on some very sinister conditions. And also, if you tend to self-medicate, you might be facing some complications associated with this condition. So, until we meet again next week with your weekly dose of wellness, this is Dr. Dilshan Fernandez signing out, wishing all of you Aibowan.